It's been 30 years since doctors first identified HIV and AIDS cases, and still the fight against the deadly global threat continues despite advances. Tuesday marks World AIDS Day, and UNICEF is warning that among youth in Asia, the number of those dying from AIDS has more than doubled since 2005. Joining us now to discuss the epidemic is Dr. Jim Small, pathologist at Porter Adventist Hospital in Denver and a member of the Christian Medical Association. Thank you for being with us today.
My pleasure.
Now, Dr. Small, how concerned should we be about the increased number of young people dying of AIDS in Asia?
Well, this is a virus that I am reasonably certain, barring some real breakthrough, is going to be with us the rest of my medical career. It's something that we pretty much know how to prevent transmission of, but getting people to, stop sleeping with people they're not married to and getting people to stop using intravenous drugs is easier said than done, and it always has been.
Amazing. Well, you helped to diagnose the first AIDS patient in Utah back in the 1980s. In the years since, what have we learned about this deadly disease?
Well, when I think back, I was in graduate school in microbiology from 1977 to 1983. So this was exactly when the HIV epidemic started. If it had started 10 years earlier, we would have been in serious trouble because we did not have the tools, the scientific tools to identify it, even 10 years earlier. We went from a description of some symptoms to a virus and a blood test within a couple of years, and that was nothing short of miraculous. What we've learned is that it is a complex virus. It has been with humans at least since the 1940s, which was a surprise to me. It is spread through certain kinds of sexual contact, through contact with body fluids, but fortunately we've also learned that it is not a very efficient virus. It takes a lot of exposure to catch HIV, thank goodness. We've also learned some effective treatments to manage it. We have not gotten, as far as I know, any real cures, and there's things about the biology of the virus that is going to make that very difficult. We've learned, precautions that have been very helpful. We've got a test so that we got multiple tests actually, so the chances of catching HIV from a blood test are less than 1 in 200,000 at this point. So we've come a long way in the scientific understanding of the disease. It's the social, moral, ethical, spiritual aspects of the disease are the tough part.
Sure. Well, how effective have medical authorities been in preventing and treating AIDS cases here in the U.S.?
Prevention is kind of a public health behavioral thing. And there was a little bit, unfortunately, when we came up with effective anti-AIDS treatments, antiretroviral treatments, some people started getting a little lazy and we had a little bump in transmission. When I first was in residency and that poor young man came in with a rare form of pneumonia, his life expectancy was less than 5 years. And now people's life expectancy with HIV is decades. The most effective program I'm aware of is in Uganda, and it was done with a big push for monogamy and loyalty to your spouse. Actually, was a huge part of the Uganda campaign. The rest of the world has been using condom campaigns and screening for the virus, and those have been, somewhat successful, but not terribly so.
Okay. Well, internationally, how would you assess where we are at in the fight against AIDS? Have we made any notable gains? And where besides Asia are the areas that we need to focus on?
Well, I think anywhere where there are human beings, there's a risk for HIV transmission. In India, it's terrible. Thailand is terrible. China apparently has had a fairly brisk increase in sexually transmitted HIV and a big decrease in bloodborne transmission of HIV. The rest of the world has a real problem because even inexpensive HIV testing of their population is beyond what their healthcare budgets can handle. And if you do find an HIV case, what are you going to do about it? They can't afford. If they can't afford the testing, they certainly can't afford the drugs. So it's. I mean, let's say it's a prostitute that gets found with HIV. Well, she is very likely not a prostitute in my experience because she wants to be. It's because this is her only option for feeding her children. And so, as I said, the challenges are social, governmental, moral, ethical, spiritual, and not so much medical.
Gotcha. Dr. Jim Small, thank you so much for your time today, sir. We appreciate it.
Oh, my great pleasure. I hope and pray that we, prayer is always a good answer here.
That's right. It's powerful. It changes lives.
Yes.
That's right.
Yes.
Thank you so much, sir.
Anytime.